and that is the panel session. Today's panel is themed Preparing Young Animal Health Professionals for the AI Era. We've had amazing presentations and we've learned about the wonderful innovation from the NovaVet family. We're about to discuss with our amazing panelists how young animal health professionals, young veterinarians, young community animal health workers can be prepared for the AI era. Joining us today is Dr. Gani Inahoro, who has been introduced earlier. We also have Dr. Namara Delilah Diana and Dr. Sheil Shamsuddin. So I want us to quickly welcome our panelists just with an emoji, clapping, a celebration, just something, something. Let's welcome our amazing panelists on the call today. Thank you. I can see the emojis. Let's keep it coming. So they feel so welcome. Thank you so much. Thank you. So I'd love to start with Dr. Namara Delilah Diana. She is a veterinarian and a researcher specializing in antimicrobial resistance, zoonotic disease surveillance, and wildlife health at the human-animal interface. Her work, her work spans laboratory diagnostics, wildlife and livestock health investigations, and research on the effects of climate variability on zoonotic disease dynamics. She currently works with Animal Allies Africa, where she is involved in animal welfare advocacy and applied research, particularly within food animal systems. She's also pursuing advanced training in epidemiology and biostatistics at the University of Cape Town. Her work is driven by a commitment to generating evidence that informs policy and strengthens health outcomes across Africa through a One Health approach. Ladies and gentlemen, join me to welcome Dr. Namara Delilah. Dr. Namara, are you with us? So nice to have you, Dr. Namara.
Hello, thank you everyone for joining us today. Thank you for the great presentations. Yeah.
Thank you so much. So quickly, I will be handing over to Dr. Undo, who will be introducing our other panelists. Dr.
All
Undo,
right.
all right.
Yes, thank you very much, Dr. Titi, and welcome, Dr. Delilah. So our next panelist is Dr. Shehu Shamsuddin, who is a veterinarian, agribusiness professional, and social entrepreneur working at the intersection of animal health, entrepreneurship, and inclusive service delivery. He is the managing director of AmbuVet Consult Limited, a veterinary and agribusiness enterprise committed to expanding access to animal health care in rural and underserved livestock communities. His work focuses on strengthening last-mile animal health systems through private sector engagement, veterinary paraprofessional entrepreneurship, public-private partnerships, vaccine access, and practical business models. He also contributes to conversation on One Health, food safety, market system, and youth professional development. At the African AI Summit for Animal Health 2026, Dr. Shamsuddin brings a systems and grassroots perspective on how young animal health professionals can prepare for the AI era by using digital innovation to solve real veterinary, livestock, and farmer-facing challenges. Ladies and gentlemen, distinguished colleagues, please welcome Dr. Shehu. Dr. Shehu, are you there, please?
Yeah, good evening, everyone. Glad to be here. Thank you.
Thank you so much, Dr. Shehu. We are so glad to have you here this evening. Our third panelist is Dr. Gani Enahoro, MNI, We have introduced him again and again. He's our father. He is an elder statesman in the veterinary profession, not just in Nigeria, but Africa and the globe. So we are so honored to have you. We've introduced him earlier, and I'll beg his pardon to kindly, because of time, to proceed further with the panel session without further introduction. Thank you so much, sir.
Thank you. I'm here with you.
All right. Thank you so much, sir. We are truly, truly honored having you up to this point. You've been here from the beginning of the session. You were here yesterday. We are so, so honored having you, sir. Thank you so much. So we are going to proceed with the panel session. And like my co-moderator said, it's going to be focused on how we can, young professionals can be better prepared for the AI era. So I'm going to begin the session. It's going to be more of a conversational session, and we encourage all participants to also take notes of questions. We are going to give a few minutes for participants to also ask their questions. So I'm going to start right away, and this question is going to go to all the panelists. So I'll start with Dr. Gani. Artificial intelligence is transforming every profession. He has already said this earlier. Some persons were not here, but I think I'll still emphasize that. So, sir, in your view, what does this mean for young veterinarians and animal health professionals entering the workforce today? AI is transforming every profession, and veterinary profession, animal health profession inclusive. What does this mean for young veterinarians and animal health professionals entering the workforce today? Thank you, sir.
Thank you. Let me express my privilege to be sharing this session with Diana and Shehu Shamsuddin. These are very young, dynamic professionals. So I'm happy to be here with you people. Yes, for young veterinarians, I've spoken to quite entering the profession at this time with AI. When we were like swimming in the dark, but today the difference is clear. So the young professionals, young veterinarians, paraprofessionals are blessed to be in this generation. It therefore means that they are having a starting point that is much improved and higher than what it used to be. But again, what you make of it depends on you. I've said it in a couple of places that every profession is good, but not every professional is good. So what you get is what you give to it. Your commitment will determine how far you will go. So lucky you, the AI as a support tool has made life so easy. You don't have to carry physical books or search for a library as huge as we used to keep to be able to get your information to navigate the waterways now. No, just in a twinkle of an eye, with a very swift response, AI will give you a guide that will assist you into addressing your clients. Remember, like I said yesterday, your clients are also sophisticated. Most of them are AI compliant, and they would have possibly read or listened to guidance from their AI, that they have searched before coming to you. So you have to be above them, at least to be able to even offer them advice. So I think this is a very good time to be a veterinarian, especially young veterinarians. Thank you.
Thank you very much, sir, for those insights. Indeed, it's the best time to be veterinarians. Thank you, sir. Dr. Shehu, would you like to add some thoughts on this? Thank you.
Yeah, Thank you very much. Thanks, VetConnect. And also, I feel really privileged to be sharing panel with the famous Dr. Gani Nahuru, and we all know his contribution to the profession and how he has been one of the very few who was able to navigate this, the different across generations of veterinarians. I think that's something that we should all learn. And he's very digital, innovative. So it means that we can also, as we grow older, continue to adapt. He talked a lot about adaptation. He's not living in the past, as you can see from the experiences he has shared. And I think this is the kind of mindset that we need to carry on as young veterinarians in the era of AI and even beyond AI. So for me, I see AI as just another phase in innovation. Tomorrow it may be something super, super faster and better than AI. So I think for young people entering the profession, it's about mindset shift. I think it's a call to action for us to begin to see ourselves even beyond, just professionals treating animals, because the AI, revolution is going to open up a lot of spaces where we originally have the training, but we tend not to focus on it. So young people should see themselves beyond treating animals and therefore think of themselves as enablers within the whole value chain, from production to service delivery to distribution to farmers advisory to public health. So along all of these value chains, there are a lot of opportunities, for us to use AI to enable, the processes and the systems to be better. So clinical relevance, clinical knowledge will still be relevant, or let me say scientific knowledge and competence will still continue to be relevant. But beyond that, we need to now add, technology, thinking, data, just like you said earlier, and most importantly, entrepreneurship. So I think it's a good time to be a vet, like Dr. Gani said, but we need, the vets who will succeed would be those who are able to combine all of this, from clinical science to technology application itself, but also entrepreneurship. How does this bring food to our table at the end of the day while solving problems for farmers or actors? So that's what I'll say for now. Thank you.
Interesting. Thank you so much, Dr. Shehu, for that feedback. So interesting, that response. So interesting. We must have that mindset shift. Very, very important, critical. Thank you so much, sir. We'll move to Dr. Diana. Dr. Diana, would you like to add your thoughts to this question?
Thank you, Dr. Shehu and Dr. Gary. I wouldn't like to re-echo what my colleagues have said, but I think I just want to emphasize the fact that in this, I think first of all, it's really exciting to be a vet right now, and the young incoming professionals should be like really excited about being born this time, because AI has come to make our work easier, as everyone has spoken about. However, I think it is really important to remember that AI shouldn't replace our clinical judgment and ethical decision making, and above all, compassion and empathy, because the field that that we're working in, really involves a lot of compassion and empathy. And AI will never replace this aspect. So we really need to remember this as young veterinarians joining the profession in this AI era. And yeah, I think that is what I will add on to the other voices.
Thank you very much, Dr. Diana, for adding your thoughts. Thank you so much. And over to you, Dr. Titi.
Thank you very much, doctors, for giving us that insightful perspective. They're very, very unique, and the emphasis on the role of AI, especially to young animal health professionals. Like they say, the young ones are the future and the present, and we need to evolve with the evolving technology. So my next question would be directed to Dr. Gani. Sir, how can veterinary schools, professional associations, and employers prepare graduates for an AI-enabled future while ensuring that they maintain and remain grounded in the core veterinary competencies and ethics, as you mentioned earlier?
Thank you, Titi. It's a whole of community approach to it. A whole of community approach to dealing with this. When I was making my presentations, I said we need to have trainer sessions for our lecturers in the universities. Incidentally, I'm also still a student. I'm rounding up a PhD program in entrepreneurship and playing, and I wanted to bring livestock entrepreneurship into their curriculum. And I found when I was defending my proposals for my thesis, the supervisor had to call me and several times made references to certain parts of my proposals that had to do with information I generated from AI, and was expecting the traditional, upper references, which is okay, but we need our lecturers themselves to upgrade. It's difficult for them to go to school. Not many elderly people like me who want to go back to school, but they need to upgrade because it is only when they understand the powers they are in AI and the information available in that space that they will be able to appreciate how to accept the energies from the students that they are training. So curriculum change will have to be, we need to deliberately and target this sector, that is the teachers at universities. So if that is done, it therefore means that the old cliche of the World Organization of Animal Health that veterinarians trained should be day one compliant will now expand to be day one compliant, of course, in veterinary practice and also in AI knowledge. So if at that level, it will now become something that should cascade down to the different countries. So I think it's a whole of community approach that we need to give to it. Thank you, Titi.
Thank you very much for that response, sir. I really love the part of the lecturers should be training the trainers. And so if they do not have this understanding, they can pass it down to the students, which is really, really very important. Thank you so much. So I will quickly be handing over to Dr. Undo for the next question.
Okay, thank you very much, Dr. Titi. Before I go over to the next question, I would like to know if Dr. Shehu has some thoughts to add to this very question of the veterinary curriculum.
Yeah, thanks so much. Just maybe to also add from another perspective beyond the lecturers, like I can relate to Dr. Gani's, I would say, situation. 2 years ago, I was in an MBA class in agribusiness, and our first, I think, project, many people, used AI for research, and then the coordinator returned all papers, and they said that they had checked with AI checkers, and everybody failed. And because of that, many people were frustrated. Many industry captains and so who were just there to learn more and interact said that, oh, after all, I don't need this certificate. And they actually left that course. Up to today, they did not return. And they went to other universities that are adaptable and adapting. So which means that university where this happened actually lost customers in quotes because they were not seeing, where the world was going to. And 2 years later, they now have a policy on AI use, and people can use AI, freely for assignments. So beyond universities, I think also professional associations have a role to play. Universities is hard to change curriculum. We all know that, and so it will not be as fast as. So while the university will check curriculum and all of that, then private sector organizations and associations like veterinary associations can include this as part of CPDs, yearly CPDs or every 2 years, so that, he said it's a community approach. So I'm helping to complete the other parts of the community, which is, the service, the associations and, other private sector employers to also join hands in helping shape the future of AI use in the workforce. Thank you.
Thank you very much, Dr. Shehu, for that response. Indeed, the private sector has a lot to do as well, and associations and institutions also have a lot to do. Thank you so much for those thoughts. So the next question is going to go to Dr. Diana. Dr. Diana has a lot of experience in the One Health approach. So Dr. Diana, with the growing role of AI in research, disease surveillance, and One Health, what new skills should young professionals begin developing today to remain competitive over the next decade?
Thank you, Jacob, for the question. Well, as we've already seen and been told that the future definitely belongs to veterinarians who have adopted to AI, I think one of those skills, first of all, is AI literacy itself. I think as we use AI in our day-to-day tasks, be it administrative, be it in assisting with diagnosis or research, I think we need to understand how AI is working to give us this output, where exactly it can add value. And we need to be able to recognize where AI stops and where human oversight becomes essential. So what I'm saying is that basically we need to really understand the limitations and strength of AI. So professionals who are able to identify this and work with it definitely will be a strength. That is a good skill. And then secondly, it is data literacy. As someone who is into research a lot, I do in One Health research, animal welfare research. So we are definitely collecting a lot of information, be it through diagnostics, health records, satellite imaging. We have a lot of data that we are collecting. So data skill, like the way collecting high quality data, that would be a really good skill, because with the huge amount of data that we have, we can obviously use AI to help us analyze data to make better, meaningful decisions. And also, we also need basically people with basic statistical skills. I know as veterinarians, we learn a lot of the complicated medicine part of it, but I think statistics is also important. Statistical skills, using software programs like R, Python. I think these skills are becoming more and more valuable in our profession. And then with the One Health, I also think that where we are at right now and where we are heading, the One Health systems thinking approach is going to become very essential. As veterinarians, we are actually custodians of public health, animal health. So, and where we are right now, we are seeing that a lot of health problems that are affecting us, be it in our continent in Africa or globally, we are seeing that AMR is a global public health threat at the moment, and it's just going to get worse. We are seeing emerging diseases and the like, and we need to recognize that these challenges are interconnected challenges. And the beauty of this is that AI poses is well equipped. It is a tool that we can use to, bring all these patterns, and it can easily identify the patterns across these systems so that we can basically analyze what's happening, make predictions, and we can only use what AI can help us if we recognize that all these fields are connected rather than working in silos, to be able to translate these insights into effective interventions. And then lastly, a very important skill that everyone has been talking about is adaptability. It's so interesting because AI is changing at a very, very fast-paced rate. Like the AI we were talking about last year or 2 years ago is not the same AI we're talking about now. And it will definitely not be the same AI we're talking about in the next 5 years. AI is doing incredible things. So I think people are more adaptable. So we need to all develop a skill of adaptability, be able to be willing to learn every day. Like every day literally is going to be a learning session if we are to use AI effectively to improve our work and efficiency. Yes, that's it.
All right. Thank you so much, Dr. Diana, for sharing your thoughts. Indeed, One Health system thinking is very critical in this AI era. AI literacy itself is very critical, and adaptability, like we've been saying again and again, it's very critical. Thank you so much for sharing your thoughts. Dr. Shehu, would you like to add briefly before we move to the next question?
Nothing much to add. I think you nailed it. Maybe just to put everything together and be a bit biased, to say that entrepreneurship skills will also be needed, because at the end you want to convert all of this into solutions that can be delivered in the long term in a sustainable manner. So AI is going to open up a lot of opportunities for us to apply layer entrepreneurship skills on AI to deliver services. So thank you, Namara, for sharing.
Thank you very much, Dr. Shehu. Indeed, AI is going to open a lot of opportunities, and as entrepreneurs, that will be something we should look out for. Okay, over to Dr. Titi for the next question.
All right, thank you. As soon as Dr. Sheo mentioned entrepreneurship, I was like, he's in my mind. He's the next person I'm asking questions. Right. So, Dr. Sheo, many young professionals are interested in entrepreneurship and innovation. People want to make money, but how can, in your opinion, how can they leverage AI and digital technologies to solve real animal health problems, especially looking at the African context, particularly in the underserved communities?
Okay, yeah, thanks, Titi. So I'm not the only one that likes money, right? So, I think that the real challenge for us in Africa, just like Dr. Gani made like a very good background to know where we are, where we're coming from, where are we right now in this race. And Dr. Femi said something yesterday to say, who are we? Who are you? We need to bring all of this high-tech knowledge, global innovation to the reality of Africa and where we are. But in doing so, we need to be careful not to start with technology, which has always been the mistake. We have seen a lot of technologies that have failed, even within our sector. What we should do is to start with the problem. So what are these daily realities of African farmers? Access is still a very big problem in rural underserved communities. Access to quality, affordable animal health care, by professionals. Quackery is still a problem. Antimicrobial misuse is a problem. vaccine, coaching breakage or lack of storage is a problem. Market access, farmers struggle to sell their products at premium price. Can we start? So as young people seeking to really leverage AI in the right way, we need to spend a lot of time, bury our heads in those communities and empathize with those farmers and learn what the real problems are. So if we're able to define these problems and see them in the day-to-day reality of our farmers or our end users or customers, then we would begin to then prepare to say, okay, so this is a problem. But again, not just knowing the problem, then you start brainstorming. So how do you build solutions or technologies or leverage existing solutions that the farmers or end users are willing to use? Because that's also another problem. You can know a problem, but maybe you're using the wrong innovation or technology at that point. So you need to meet the farmers. We need to meet the farmers or the end users, at the center. What are they prioritizing? What are they willing to pay for? This brings me to entrepreneurship. We need to be able to see that these farmers so much value this solution to the extent that they can pay for it. So who pays? What is the problem? Who are the people suffering from this problem? And partnership. How do we create, partnerships? How do we solve these problems collectively? The era of one company, claiming champion, trying to be everything, like it's over. So how do we leverage partnership within public sector, private sector, producer organizations? How do we partner and share resources, share risks, and then be able to take these solutions to solve problems that are really bothering our farmers? If we look at the farming, if we're looking at the animal health value chain from perspective of just service providers. But just like I said earlier in the opening, it's even beyond our clinical intervention services. Veterinarians are already well grounded, to become entrepreneurs, advisors, value chain advisors, to become farm managers or farm advisors. So we need to look at the whole spectrum of the value chain. What are the different levels from inputs? How can we use AI, to promote our services as animal health professionals within input production at the hatchery level? Let's say if we take, the chicken value chain, and then you come to this, primary production. If you're a vet consulting for a farm, how is your presence, your services in the farm making the farms to be more profitable, to have better productivity, to have less mortality, less morbidity, and produce, better output? If you're at distribution level, or maybe you sell veterinary drugs or vaccines, how are you leveraging your knowledge? Using your knowledge to leverage AI to ensure that these vaccines get to where they are properly, sourced, stored, distributed in a way that is profitable to the company. If you are a mobile vet, or a paravet at the community level, how are you taking this knowledge to the farmers and knowledge and services to the farmers in a way that they are going to be better off, engaging with you than not? So, but just to conclude this, we need to be careful, just like I said, not to AItize everything. So this is a word I coined. I don't know if it exists. We don't have to AItize everything. We need to look at, just like Namara said earlier, where is AI really going to add value in what we do, and then we run with it. So I would like to stop here. Thank you.
Thank you so much for the response, sir. I really love the part of saying know the problem so you can know the right tech to use to address that problem. And I love the emphasis on addressing it at the grassroots level. Sometimes we're always looking at the top, forgetting the people, the end users of this technology. Thank you so much for your response, sir. And I think we'll be moving to the concluding part. Is that the case, Dr. Undo?
Okay, because we maybe just before we go to the concluding part, we have our father, Dr. Gani, who is, when it comes to the entrepreneurship area, he I am sure he has some thoughts to add to what Dr. Shehu has shared. Thank you so much, sir. I don't know whether I should read the question again.
Well, I've been following you, and I align with what Shehu has very correctly said. If you listen to him very well, you will see the element of MBA training. We need to go to school, honestly. I've learned a lot in my PhD program in entrepreneurship and innovation management. I was a champion. In actual fact, I'm a certified entrepreneur. I have fellowship in this Certified Institute of Entrepreneurship in Nigeria. But when I got to the PhD program, I discovered that we are practically working like quacks and allowing others to make money because of lack of knowledge. Shewa and I have been involved in training veterinary paraprofessionals, and we have impacted, according to them, so much because they had the opportunity to now relate with more education. Let us go to school. Shehu said it. We don't have to think of ourselves as veterinarians only in the scheme of giving injections to animals. There is a wide opportunity available in livestock entrepreneurship beyond what we know. You see? So I want to say that first, I'm grateful for this opportunity, and I will highly recommend that we do more of this kind of opportunity sharing, knowledge sharing. It will go a long way. Most of the complaints we have, Diana was very clear about the opportunities, the skills available in AI to veterinarians. I will send my presentation to you so that you can share to everyone. I mentioned clinically areas like digital literacy. I can always expand them. You can make a lot of money from digital literacy, critical thinking skills, data interpretation skills. You need to see how much of benefits and income is available in data interpretations, which we leave to the hands of the social scientists, students or graduates, that we can do better. When during the academic aspect, what they call it now, the aspects that had to do with attending classes and doing exams in the PhD class, and I was looking at the quality of materials they were asking us to do exams on, and I realized the huge veterinary curriculum that we passed through. I wasn't reading and I was passing the exams, so to speak. So we have so much in us as veterinarians. We can tease out a lot of these things from AI. People go into AI, you can assist people to use your experience and interpretative abilities to make money from them, not for free. So please look through I mentioned all of this in my presentation, and I can always expand them at any future opportunity. Thank you. I know we are running for time now. I appreciate this opportunity. Thank you.
Yes, thank you so much for sharing your thoughts. We are truly grateful. Just before I hand over to Dr. Titi, please, this is to all participants. We have an important announcement in the chat box. We'd like you to take just 5 minutes to fill this summit assessment. It's not an exam. We just want to know how impactful this program has been, and your thoughts will help us also improve the program subsequently. Titi, over to you to conclude with the last question. Thank you.
All right, thank you so much. Thank you to all our panelists for the amazing responses so far. It has truly been enlightening and inspiring too. Thank you so much. And we're quickly moving to the concluding part. when you see the theme of this, the sub theme, it's AI adoption and the future of veterinary practice in Africa. We cannot talk about the future without mentioning the young veterinarians, the young animal health workers. And so, if there is one thing, if there is one keyword you want every young person or every professional on this call to take, if there is any advice you'd love to give them about thriving in an AI era, what would it be? So, we'd love to begin with our father, Dr. Gani, followed by Dr. Delilah, and finally Dr. Shehu. Dr. Gani, would love to have you, sir.
Well, just like I concluded in my comment a few moments ago, every young vet should go to school. DVM is just the beginning. Don't make it the end. I have a master's in veterinary pathology, clinical pathology. I have a master's in business administration. I was concluding a PhD program in pathology before I saw this PhD program in entrepreneurship, and I'm there. I have MNI. So there cannot be, you can only limit yourself. So we should go to school and add more education to what you have. Your critical thinking ability will change. That's my advice. Every other thing is easy. Like Shehu said, we have been grounded in veterinary practice and medicine in 5-6 years in school. But that is not enough for us to live on. The world is bigger than veterinary practice. I've done veterinary practice for 41 years. It is than veterinary medicine to you. Please go to school. Don't limit yourself. Don't say because you're to private practice. No. I have never written an application to work for government. Never. And I have all these certificates that I can be proud of today. They have shaped my outlook to life professionally and even in public speaking. So please let us go to school. So I would conclude that by allowing Shehu to add his voice to this. Thank you.
Thank you very much, sir, for the wisdom. We have really learned a lot today, and also from yesterday's conversations. I want to just conclude by saying, yes, embrace AI, run with it, but don't embrace AI for the trend of it. Embrace AI because you want to use it to solve problems, real problems, but also because you want to use that to earn better living. I mean, be able to afford PhDs in entrepreneurships and all of these things that the likes of Dr. Gani have been able to achieve. It requires some level of investment, and it means that you need to leverage this AI as an enabler, while, always referring to your science, scientific knowledge, your empathy, communication. All of those things, we need to combine all of that for us to be able to effectively, use AI for the benefit of ourselves and for the people and for the planet. So embrace AI, but also try as much as possible to develop those skills that is needed for you to make better use of AI, or make best use of AI in your life, and also in making impact in the world. Thank you.
Thank you so much, sir. So we'll be having Dr. Delilah.
Thank you so much. I also want to thank Dr. Gani because I also needed that advice as a young professional myself. Going to school is quite important, and the time is now for all young professionals there. And then with the AI era, I think I just advise everyone out there, the young professionals, that it's not about between choosing artificial intelligence and human intelligence, but rather combining the two. Today I just paid for ChatGPT Pro Not because I can't do what it does, but because I'm just trying to, to use it to use it as a leveraging tool to see. But I know its weaknesses because I've used it several times, and I know the weaknesses between the free version. I know the weaknesses of the paid for version. So I think as a young professional out there, I think it's a good opportunity for you to start learning about AI, how you can use it, how it can make your work more efficient to make you the best in your field anyway. So it's not a competition, but rather an important tool that you can always just, manipulate around and play around to ensure that you produce the best output out there. And of course, I also want to really emphasize that go to school and also diversify a bit from your field because Dr. Gani has a master's in MBA and all these other skills. So I think we should also be more open to diversification because I know specialization is important, but diversification is also important. So that's it for me.
Amazing. Thank you so much, Dr. Diana, for sharing your thoughts. And once again, thanks to all our panelists. Thank you, Dr. Shehu, for sharing your thoughts. Thank you, Dr. Gani. It's been so inspiring listening to all of you. And thank you for honoring our invitation. We are so glad having you. And it's been such an inspiring session. Thank you so much.
Yeah, Doctor.
Before, yes, over to you, Titi. Yeah.
Yeah, I just wanted to add something like from the advice. One very key thing is we should go to school. Go to school. Don't forget the ethics, merge AI with human intelligence. Get that pro version and sign up for Novavet.
All right. Thank you, Dr. Titi. Please